My name is Paul Kennedy. I am the author of Beating Diabetes: How to Defeat the Horrors of Type 2 Diabetes. Type 2 diabetes is a silent killer. When you first become diabetic, you experience few symptoms and no pain. But this sneaky disease gradually destroys your health unless you do something about it. There are 13 vital reasons why you must beat your diabetes. If you fail to control the progression of disease, you will end up with several horrible health problems. These include heart disease, stroke, kidney disease, nerve damage, damaged hands and feet, digestive problems, damaged eyes, glaucoma, cataracts, retinopathy, infections, erectile dysfunction if you are a man, and dental problems. We'll have a look at these severe health problems, each in turn. Heart disease is a catch-all name for a range of diseases relating to the heart. It includes diseases of the heart itself, such as heart failure. Heart disease also covers diseases of the system for circulating blood around the body, a prime example being hardening of the arteries. Heart disease can trigger a range of devastating events, including heart attacks. Heart disease is one of the most common results of diabetes. Other causes include being overweight, high cholesterol levels, high blood pressure, and smoking. Your age and family history can also increase your risk of heart disease. Most diabetics who do not control their blood glucose levels die from this common disease. Indeed, everyone is at risk of heart disease. Diabetes increases that risk many times over. A stroke is a loss of brain function that occurs when the supply of blood to the brain is stopped suddenly. A stroke can paralyze you down one side, prevent you from speaking, stop you understanding what people are saying, and affect your vision. A stroke can even kill you. Strokes, indeed, are the leading cause of disability in adults in Europe and the USA, and the number 2 cause of deaths worldwide. Diabetes is a major cause of strokes. Your kidneys purify your blood and send waste products into your urine for excretion. This means that if your kidneys are badly damaged, they won't be able to perform their basic function, and you'll end up poisoning yourself with your own waste. Think about that for a second. Your waste, instead of leaving your body in the normal way when you go to the toilet, will remain in your blood to poison you. Your kidneys also have an important role in the regulation of your blood pressure. Thus, damaging your kidneys will also cause blood pressure problems. If you do not prevent your kidneys from becoming damaged, you will end up needing kidney dialysis 3 times a week. Eventually, you will need a kidney transplant. Uncontrolled diabetes is a leading cause of damage to the kidneys. Your nervous system is made up of thousands of fibers that connect your brain and spinal cord to every part of your body. This system controls your blood pressure, temperature, breathing, pulse rate, and digestive system, your ability to move, listen, and talk. Long-term diabetes can damage these nerve fibers. This damage is called diabetic neuropathy. Once it has happened, this type of nerve damage is permanent and cannot be reversed. However, you can allay some of the symptoms a bit through diet and exercise, but there is no cure. The only way you can avoid diabetic neuropathy is by taking control over your diabetes before your nerves become damaged. Uncontrolled diabetes will damage the nerves of your feet and hands. This is known as peripheral neuropathy. When you have peripheral neuropathy, your feet and hands will tingle or feel numb, painful, or weak. They may feel as if they are on fire or frozen solid. This happens because the nerves that allow you to feel things or move your muscles have been damaged. Peripheral neuropathy can be very dangerous. It can make you vulnerable to injuries you cannot feel, cause you to overlook minor cuts and bruises which can take a long time to heal, another consequence of diabetes, and become infected, and to cause infections to fester and make amputation necessary. Indeed, uncontrolled diabetes is a common cause of amputations of the feet and lower limbs. Once it has taken hold, peripheral neuropathy is almost impossible to reverse. The only sensible thing to do is to take steps to beat your diabetes before it sets in and you are on the road for amputation. The vagus nerve controls the flow of blood through the small intestine. Diabetes can cause abnormalities in this nerve. This condition is known as gastroparesis. Gastroparesis has very unpleasant consequences. Your appetite will be reduced and you have bouts of vomiting. You suffer weight loss and feel extremely tired all the time. You'll also have solid masses of undigested food in your stomach. The undigested food, along with high levels of glucose in your blood, will make you prone to bacterial infections. You will also be unable to monitor your blood glucose levels, and so you'll be unable to control the effects diabetes is having on your heart, kidneys, nerves, feet and hands, and eyes. All these problems are caused by years of uncontrolled diabetes. The best thing you can do is learn how to beat your diabetes and take the steps necessary to bring it under control before your digestive problems begin developing. Your eyes contain thousands of minute hair-like blood vessels. They are highly fragile. These tiny blood vessels are especially sensitive to glucose in the blood. Diabetics have excess glucose in their bloodstreams. Protecting your eyes means keeping your blood glucose, blood pressure, and cholesterol levels under control. Only a diet that reduces your glucose and blood pressure levels and that helps clean out your arteries will be kind to your eyes. Some, but not all, changes in the eyes due to diabetes, such as exudates in the retina, can improve with a switch to a plant-focused diet. Other changes are irreversible, but they can be prevented in the first place if you learn to take control over your diabetes. Having glaucoma means that your optic nerve is damaged. This damage is caused by a build-up of pressure in the front of the eye, which pinches the tiny blood vessels in the retina. If discovered early enough, glaucoma can be treated effectively, but if you leave it untreated, glaucoma can make you blind. High blood glucose, due to uncontrolled diabetes, and high blood pressure increase your risk of getting glaucoma. Your best defense against blindness due to glaucoma is to learn how to beat your diabetes and to keep your blood pressure under control. Cataracts is the name for a painless clouding of the lens of the eye, which makes it increasingly difficult to see properly. Cataracts take a long time to develop. Your sight worsens gradually over time. Thus, the older you are, the more likely you are to develop cataracts. Diabetes is a main cause of cataracts, among many other causes. You can reduce your risk of developing cataracts by eating less fat, drinking less alcohol, avoiding dairy products, and by eating foods rich in antioxidants, such as lutein, zeaxanthin, and in vitamins C and E. Learning how to beat your diabetes through diet is the best way to reduce your risk of cataracts. The retina at the back of the eye consists of millions of tiny nerves that pick up images, convert them into electrical signals, and send them to the brain. You have retinopathy when these tiny nerves have been damaged. Retinopathy can only be detected by an ophthalmologist. Diabetes is the most common cause of retinopathy. It is also caused by high cholesterol or high blood pressure. In advanced retinopathy, your retina can scarred and detached, and you can suffer severe vision loss, even blindness. The best defense against retinopathy is to maintain your glucose, cholesterol, and blood pressure at their correct levels by eating a plant-focused diet. If you are diabetic, your immune system will have lost much of its ability to fight infections. This means that, compared to a non-diabetic, you are more prone to developing infections, because high sugar levels in your tissues are providing a fertile breeding ground for bacteria and fungi. These infections can affect your bladder, kidneys, vagina, gums, feet, and skin. About 1/3 of diabetics get a skin infection related to their disease at least once in their lives. These can usually be treated successfully, but can turn into a serious problem if not treated properly. The best defense against infections is to learn how to beat your diabetes by controlling your glucose levels. At the same time, you still need to treat infections. Erectile dysfunction refers to a man's inability to gain or maintain an erection. The risk of erectile dysfunction is increased by diabetes. Your best defense against erectile dysfunction is to eat a plant-focused diet, quit smoking, exercise regularly, and reduce stress. White blood cells are your main defense against infections in the mouth. Uncontrolled diabetes, unfortunately, impairs white blood cells. Thus, a diabetic has a higher risk of serious dental and oral health problems than a non-diabetic. The best defense against dental problems is to learn how to beat your diabetes, and to use that knowledge to keep your blood glucose levels under control. There you are. That's the 13 vital reasons why you must beat your diabetes. Are you scared? Scared enough to act? If you are diabetic and do nothing to control it, the consequences will be extremely grim. Everything from heart attacks, disabilities, dialysis, transplants, infections, amputation, blindness, to death. Beating diabetes means avoiding the health horrors of uncontrolled diabetes by controlling your blood glucose, cholesterol, and blood pressure levels, and giving up smoking. How? By a few minor changes in diet and lifestyle. Nothing too drastic. The book Beating Diabetes by Paul Kennedy describes in simple language how you can take control of your diabetes. This ebook includes a wealth of information on how type 2 diabetes is caused, the information you need in order to tackle it successfully, the diet you should follow, and how you can monitor your progress. You can buy the book from Amazon.com or Amazon.co.uk, or you can find out more from beatingdiabetes.com. That's beating-diabetes.com. Thank you for listening. Hi, my name is Paul Kennedy,